Good evening. My name is Dr. Reed Tuckson, a co-founder of the Black Coalition Against COVID, and on behalf of all of us at the BCAC, welcome to this special town hall, COVID and the Holidays. Protecting Black life matters, especially this year. As much as we wish it were so, this pandemic is not over, and our collective responsibility to protect and preserve the health of our community, especially our seniors and the vulnerable among us, is not over either. We have a lot of information to cover tonight, and we're excited to bring it to you. And we have some really engaging guests and experts. So let's get right to it. And by the way, those of you that have questions, please put them in the chat, and we'll get to as many of them as we can during the show and certainly at the end of the show. Well, to center us on why this conversation is of such importance, it is my pleasure to introduce Dr. Ashish Jha, the White House's COVID-19 response coordinator, whose convening of a special briefing for minority health leaders a few weeks ago was the stimulus for us to produce tonight's hall. We are so glad to have the leader of our nation's fight against COVID joining us tonight. Dr. Jha, what's it look like from your point of view?
Well, Dr. Tuckson, thank you. Thank you for convening this important group, and thanks for having me here. On behalf of the Biden-Harris administration, I feel honored to be a part of this. So much gratitude for your individual leadership, Dr. Tuckson, the leadership of this entire coalition. And these town halls, I believe, have been instrumental in spreading good information. As we know, one of the challenges we fight today is all the misinformation and disinformation that's out there. And the best way to counter bad information is with good information. So thank you again for pulling this town hall together. So your question, where are we? What does it look like from my vantage point of view? I would start off by saying, obviously, we're in a much better place with COVID than where we were. If you think back to where we were last fall and winter, certainly where we were 2 years ago, it is clearly just much better. And it is tempting at that point to say, well, COVID is over, let's move on. The problem is it's not over. The virus is around. And right now we are seeing in the last few weeks the emergence of a couple of very, very immune evasive variants that will, I believe, over the next 3-4 weeks become dominant in the country. 300 to 400 Americans are still dying every single day. And if that continues, we are going to see COVID be one of the top 3 causes of death in 2022 and continue into 2023. And we're facing a fall and winter ahead where we know people are going to gather, and they should, and they can safely. We're going to see people gather over Thanksgiving, over the holidays, lots of socializing, really important things. But we also know that respiratory viruses tend to spread during that time. So given these challenges, we've got some work ahead of us, and I want to talk a little bit about some of that work and I think what we can all be doing. So the good news is we have got brand new vaccine. This brand new vaccine updated for the variant that's circulating out there. And the data we have seen just in the last couple of weeks. So Dr. Tuckson, I think last time we talked was about 3 weeks ago. Just in the last 2 weeks, we've seen some brand new data that these new vaccines are working way better than the vaccines we had. The updates are really making an important difference. Where it gets challenging and where I get really concerned, and this is something that we've talked about, is the uptake of the new vaccines is still quite low. About 30% of seniors over 65 have gotten the new vaccine, meaning 70% have not. But when you look at that number a bit more closely, what you see is that about 1 in 3 seniors who are white have gotten the vaccine. And among Black seniors, among older Black Americans, that number is more like 1 in 6. So we're already seeing the emergence of a large gap between white Americans and people of color, particularly among seniors. So we're seeing that across all age groups. This to me is very, very concerning and something we got to address right away. Now, the good news is we know how to do better. We just had a health equity summit. Several of the key folks who are part of this coalition were there. Big part of that summit was celebrating and acknowledging the hard work of so many organizations, including BCAC, in showing that we can close gaps, we can end disparities when we put our time and effort and our attention and our resources behind it. And your efforts certainly have been critical to this. But we got to go back and do that again. Now, we know people will be spending a lot of time together with their family and friends. And we've got COVID, you've got flu, you've got RSV. And so the stakes here are high. because if we do our job and we get people protected, people can have a very safe and healthy holiday season. But if we don't, obviously we're going to be looking at a lot of people getting unnecessarily sick, unnecessarily landing in the hospital, or even worse. So let me finish by saying, here's what I think our agenda, our collective agenda, is certainly the commitment from this administration. First and foremost, we got to make sure everybody, but particularly older Americans, go out and get their COVID vaccine, this brand new updated COVID vaccine, and they get their flu shot as well. Both of those viruses are out there circulating in large numbers, and we can do a lot to protect people. Second, if you don't feel well, get tested. Because right now we have widely available treatments that can save lives. The good news is if people are up to date on their vaccines, and if they get treated if they have a breakthrough infection, we can drive those deaths, the 300 to 400 deaths a day, down to zero. That is what possible if we all do our part right. So get updated vaccine. If you have symptoms, get tested. Get treated. If you get a positive, if you are infected, get treated. I believe everybody over the age of 50 should be getting treatments at this point. And if we do all of that together, we can save lives this holiday season. We can protect ourselves, our families, and our communities. And we certainly are committed to that. And we're excited to work with all of you to help you do the great work you've been doing over the last 2 years.
Well, Dr. Jha, thank you so much for that. Thank you for your leadership. And we'll let you get back to, we know you have several other meetings, that your day is not over. Leading this effort is a huge sacrifice. And just know that we are grateful for everything that you are doing. Thank you.
Thank you, Dr. Jackson.
Great. Well, our community is fortunate to have a robust community infrastructure with responsible leadership that cares deeply about protecting Black life. Make no mistake, our leaders across the spectrum of Black life are not ambivalent about the urgency of taking action this holiday season to protect all of us against COVID and other related health challenges that are confronting us today. We're turning to greetings from several of those leaders in a moment, but two of our leaders have had challenges this evening. One, Reverend Al Sharpton, who is the chairman of Choose Healthy Life. His plane just landed, and he probably will not be able to make it in time for the show, but he's called us and let us understand that he wants you to know that the faith leaders in our community have really come together as through initiatives like Choose Healthy Life and Values Partnership and other faith-based initiatives have come together to really emphasize how important it is that we do what we need to do, what Dr. Jha said we should do, as we not only come together as family, but as we come together as church, as we come together as congregations. And the Choose Healthy Life movement that he co-chairs, along with, and unfortunately we lost the other co-chair, Reverend Calvin Butts, and our heart still goes out to his family. That movement is powerful and strong. And we'll be hearing from one of the people who do the work of Choose Healthy Life on the ground, one of the health navigators we'll be hearing from later in the show. We are also sad that our good friend, Guinevere Catchings-Hess, who's the president of the Black Women's Agenda Incorporated, unfortunately has come down with an illness. However, she felt so strongly about her appearance tonight that she asked me to share her pride in representing an organization that was founded in 1977, devoted to advancing, securing, and protecting the rights of Black women and their families, and working with and through their 24 national collaborating organizations, many of whom are sponsors of tonight's town hall. This is important because together they represent over 3 million women. And that means that they are touching, according to our president, touching over 3 million families and communities. And that is, in fact, powerful. She asked that I express BWA's unapologetic commitment to protecting Black women, Black families, and Black communities. Protecting them from COVID this holiday season, she considers to be imperative and is imploring all of her members to get involved and do what's necessary to be done. Particularly, she is concerned because she's seen the numbers around COVID. And what she is particularly worried about is the CDC data that indicates that Black people are twice as likely as white people to be hospitalized for COVID and almost twice as likely to die. And that the data for Black women is just as daunting, where she quotes from a study from Harvard School of Public Health that states that Black women are 3 times more likely to die from COVID as white men. She is energized by her belief that Black women can be the key to keeping our community spread low, because Black women are, in fact, the chief health officers of our family and our communities. And as such, they play a critical role in protecting Black lives from COVID during the holidays and through the year. We wish you a speedy recovery, President Catchings-Hess, and thanks for taking the time to send those messages, even though you were under the weather. And now I turn to Dr. Willis Lonzer III. He is the General President of Alpha Phi Alpha Fraternity Incorporated and also the Vice Chair of the Council of Presidents. Dr. Willis Lonzer.
Thank you very much, Dr. Tuckson. It's a pleasure to be here.
And if you would share with us, sir, how you, as a leader of the Black fraternity movement, why this evening is so important to you.
Well, I think it really is critical for us to embrace the seriousness of COVID-19 and the flu season that is here. And as just as Dr. Josh spoke to the RSV, that's also challenging the community. I'm happy to report, though, that not only is Alpha Phi Alpha fraternity, but all of the Divine Nine fraternities and sororities have come together to create a campaign of messaging around getting the vaccine, as well as even addressing the flu vaccine and ensuring that the community sees that this is a serious impetus here. As it's been stated, many times the sisters or the wives and women in our lives are particular through a specific health campaign that we are in concert with the Divine Nine, with Good Health Wins, is promoting the concept of vaccination, education around COVID-19 and influenza, so that our community can embrace a safer environment. Our meetings have been impacted in a very favorable way so that we can ensure that our members and encourage our members to be vaccinated, not only with the for COVID-19, but also for influenza, as well as addressing other health issues. In fact, Alpha Phi Alpha has also, under my leadership, appointed a Surgeon General for the fraternity to educate our brothers and also enhanced our outreach in the community with community partners through other committee opportunities that we have on a general organization or global basis. It's important that we educate our membership so that we can be better community partners. We significantly embrace the fact that Black men should be leaders along with women to ensure that the Black community is healthier, that we are living longer, and that we embrace the challenges that face us as a community at large. I think that we have seen an uptick, according to the Good Health Wins data, working with the Divine Nine in those whom we impact, to see that there has been a very favorable response to considering getting the vaccinations earlier. And certainly we join in concert with the new vaccine that's available to ensure that our membership is going to actually be vaccinated, and encourage them to encourage their families, friends, and community as well. So I welcome that, Dr. Tuckson.
Thank you so much. And I just have to note that between the combination of all the organizations that you are associated with, along with President Catchings-Hess of the ABW, that our flyer that went out to market and talk about and advertise this program has well over 20 different organizations that are a part of Black fraternity and sorority and Black social community life. And so we are really pleased that both of you were able to provide so much leadership for this program tonight. And with that, as we have our faith leaders represented, our social and fraternal organizations represented, we also have our Black health leadership represented. And now turn to Dr. Garfield Clooney, President of the National Medical Association, for his words of welcome and insight. You might take it off mute there for a moment.
Apologize for that. Thank you very much for this opportunity to address this group and to give remarks regarding COVID and the holidays protecting Black life matters, especially this year, on behalf of the National Medical Association and the 50,000 physicians whose interests we represent. Dr. Tuckson, I'm always amazed at how you can bring together stakeholders in an effort to improve the lives of African Americans. I've known you and followed your career since I was a medical student, and I applaud your efforts to bring this urgent town hall to us today. Thank you for your undying efforts and selfless motivation to helping others. As we all know, in March 2020, the world essentially shut down due to the COVID-19 pandemic. Since then, COVID-19 has claimed the lives of over 1 million people in the United States, and the number is still growing. Over the course of the COVID pandemic, analyses have shown that people of color have experienced a disproportionate burden of COVID-19 cases and deaths, and all indicators point to this trend continuing into the foreseeable future. And importantly, long COVID has also disproportionately impacted members of the African American community. Many individuals during the peak earning years that have developed debilitated diseases, symptoms, and that interfere with their jobs and their educational pursuits. In addition, they have significant problems finding care. According to information published in the journal Nature about 2 months ago, emerging variants and waning immunity are likely to push infection rates higher in the northern hemispheres as influenza, COVID's ugly cousin, makes a comeback. And we also have to be concerned about the rise of RSV this year in young children and people over 65. Therefore, there's a triple threat out there that may wreak havoc on our community this season. Know this, though, that this threat can be abated by obtaining full protection against COVID-19 and influenza. We can reduce the risk of illness and death in the African American community. The National Medical Association has worked diligently and creatively to reassure the African American community, patients, and healthcare providers alike of the safety, efficacy, and importance of the COVID-19 vaccine through our task force on vaccines and therapeutics. The OBGYN section of the NMA, for example, has also created public service announcements that explain the importance and safety of the vaccine for Black birthing people, a segment of the population who are also under-vaccinated. We also understand that Black health professional organizations, including NMA and the National Black Nurses Association specifically, are the trusted messengers and subject matter experts, and we acknowledge our obligation to ensure vaccine confidence and advocate for more access to vaccines and testing in areas that have been historically and systematically disproportionately underserved. To this end, I look forward to working with all the groups represented here as we coalesce our efforts to make a collective impact on the COVID-19 pandemic. Lastly, I implore us all to continue to spread the word on the effectiveness of good hand hygiene and other safe practices, which have been shown to be so important in reducing infection in general. Thank you again for this opportunity.
Oh, thank you so much for your leadership, Dr. Clooney, and all of your colleagues at the NMA who have stood tall since the very beginning of this pandemic, speaking truth, science, and evidence-based information that is trustworthy to our community. In that regard, we are now joined by Dr. Wayne Frederick, president of Howard University, a noted physician, a great leader, and who has some perspectives to share on behalf of our 4 Black medical schools. Dr. Frederick.
Dr. Texan, thanks again for putting this together, and thanks for your work over the course of this pandemic. The work of the Black Coalition Against COVID has been life-saving, to say the least. At the beginning of the pandemic, when testing was not widely available, the Black medical schools represented by Charles Drew Medical School in LA, Meharry Medical College in Nashville, Tennessee, and Howard University here in Washington, D.C., and Morehouse Medical School in Atlanta really stepped up to work with industry to try to get testing to those individuals who were at risk. This proved to be very important because we would then learn that frontline workers, a vast majority of whom were underrepresented minorities, put themselves at risk for the rest of us. And while we have certainly praised their heroism, we lost many of them, and we would like to try to continue to stem those losses. We then participated in clinical trials, which have proven these vaccines to be very effective. And one of the messages I'd like to make sure that we pass on as a representative of the 4 Black medical schools tonight is that the vaccine, the new vaccine, has proven to be extremely effective in preventing some of the new variants of COVID from wreaking havoc in our communities. And as you heard from Dr. Jha earlier, the uptake in terms of the number of African Americans who are being vaccinated is low. So we want to encourage you to go ahead and get the booster shots. And if you have not been vaccinated at all, this is certainly the time to be vaccinated. The reason for that is as we get into these cold winter months and we start getting more respiratory infections, there will be more confusion around whether one has COVID or one has a flu or one has a common cold. And so you don't want to take the chance being around others who may be infected, but be in a lot healthier situation than you are. So there are a few things that we do want you to think about. As you gather, we want you to have conversations about being vaccinated. We think it's important for you to protect one another. We want to remind you that being vaccinated protects others. My mother, who is approaching 80 and has been diagnosed with a bladder cancer, has been treated successfully, will join us for Thanksgiving. And so it is imperative that myself, my two younger brothers, and our entire families will have to be vaccinated to be around her. And I'm happy to report that we all are. But that's the type of thing that we have to be thoughtful about, because while younger people may do well, even if they contract COVID, we have to be concerned about the elderly to whom we may pass this on. So as I leave you, I want you to remember that we consider ourselves trusted messengers in the community as Black physicians, but we recognize that in order to pass on our message, we need you to be our foot soldiers. We need you to carry that message into your community. So we want to encourage you to have those conversations, to express to people that your love for them is why we want them to be vaccinated, and that our love for you is why we want you to be vaccinated this holiday season. So please be safe and enjoy your holidays.
Well, thank you so much, Dr. Frederick. And again, your leadership has been impeccable, and we thank you for it. So as we move our program, what you can certainly, I hope, is become so clear to everyone in the audience is that our leadership across the breadth and depth of our community, and we will have people from other parts of our Black diaspora and our Black community on the show in segments that will be coming up later. But what you can see is that our leadership is standing shoulder to shoulder, being very clear about our collective response to this call to action. And this really is a call to action. Well, Dr. Jha opened up the program with a good broad perspective and context of where we are. Now let's dig a little bit deeper. And we're very happy that Dr. Barbara Mann is with us. She is the director of the Division of Bacterial Diseases for the National Center for Immunization and Respiratory Diseases at the CDC. So we could not have a better expert to join us. Welcome to the program, Dr. Mann. And thank you for joining.
Good evening, and thank you so much for inviting me. I'm so happy to be here. And I'll just give you an update that I'm currently serving as the acting director of the proposed new coronavirus and other respiratory viruses division. So even closer to the problems that we're dealing with as respiratory situation is really heating up and causing a lot of challenges this year.
Well, even better for me to ask you then this question that, it's been alluded to a couple of times by our previous speakers that we're facing a number of threats as we go into the winter and holiday seasons. What are you and your colleagues most concerned about right now?
That is such a good question, and I'm really pleased to have the chance to talk with you about it. So, as you said, we're concerned about a wide variety of respiratory viruses, including COVID. COVID is also caused by a respiratory virus, but let me talk about some of the other respiratory viruses first, and then a little bit more about COVID. So there are a lot of respiratory viruses that circulate year-round in the United States, always have. Pre-pandemic, we may not have paid quite as much attention to them. They've typically been at higher levels in the fall and winter. Over the last, I'm a pediatrician, and we always called the fall and the winter the respiratory season, because that's when we would see so many little children coming in with respiratory diseases. In the last couple of years during the pandemic, that normal fall-winter pattern has been very much impacted by the pandemic, and the circulation of these other viruses through our communities has often been atypical as a result of that. So, for example, in the winter of 2020 to 2021, there was very little circulation of influenza or flu. which is usually responsible for a large bulk of the respiratory disease in that time period. Same thing happened last year. It was not a bad flu year. And this has been true for some of the other respiratory viruses as well. But right now, as we're in a better place with COVID, as Dr. Jha said, we are experiencing a real resurgence of the other respiratory viruses, so flu, RSV, and a number of others.
But Dr. Mann, could you mention what does RSV stand for?
Yeah, I'm happy to. So RSV.
Oh, we may have an internet challenge here. Let's see. Can you hear us, Dr. Mann? We'll give her a chance to have her system reboot, and I'm sure we'll get back. But the respiratory syncytial virus is what the RSV terms mean. And she was just about to make an important point about that. But what we may have to do is to come back to her in just a few minutes. And that gives us an opportunity to start to tee up our next guest. And if our producers will do that, we will, and then keep me notified, because we certainly want to finish with Dr. Mann. But while we are waiting for her to get her connectivity back, let us move into a discussion about the vaccines themselves. And I do hope that that we will be able to move to our next guest, and the producers seem to be saying it's okay. Oh, no, now Dr. Mann is back. So Dr. Mann, are you back now? Dr. Mann, it looks like she is back. All right. Well, very good.
Yeah.
Listen, we are very mobile and facile here on our show, so no problem. You were making a point about the respiratory syncytial virus as being in combination with the flu and COVID, and please continue your point.
Yeah, and I was just a little bit of background about respiratory syncytial virus, RSV, because many people haven't really heard about it before, but it's important to know that this is not a new virus. It's been around for a long time. It typically affects young children and older adults most. Most kids will get infected with it during their first 2 years of life. And usually it just causes mild cold symptoms, but it can cause more severe illness, bronchiolitis, which is a wheezing illness of mostly of young children. And actually something like 2% of little children under 1 will be hospitalized for RSV at some point. And we're in the midst of a big resurgence of RSV, high rates really across the country, especially right now in the Northeast and in the West, the western part of the country.
So these combination of things with flu, RSV, and COVID, how do you know which one you have?
Yeah, well, it's the symptoms can also, it's really important to get tested. Only with testing, I'm afraid I've just, am I back?
Oh, no, we're hearing you completely. Please continue.
I keep seeing myself, but not seeing you. Only by being tested can you know whether you have RSV or influenza or COVID, because there is so much overlap in the symptoms. And it's very important to be tested because there is prescription antiviral treatment that can help greatly with influenza and with COVID, especially for people who are in high risk groups. But that has to be diagnosed early for those medications to be as effective as possible in helping keep people out of the hospital.
Well, you've been very clear. Let me just double down on this. So if I'm someone who has the symptoms of a runny nose, sore throat, maybe fever or not, it may seem like the cold, it may seem like a flu, it could be the symptoms of COVID. You're suggesting that the thing I need to do is to go first and get one of the COVID tests and make sure that we can rule out COVID. And if it is COVID, we can then have the right things done in a hurry early in the cycle. And also then we can be able to work with our clinicians around whether or not it's the flu or RSV. Is that the main point you're making?
That's exactly right. It's important to know, especially if you're a person who's at higher risk for getting severely ill, or of course, if it's a young child or anyone who is severely ill with trouble breathing or high fever, it's important to get medical care, to get tested, to find out what you have so that you can be treated appropriately.
Thank you. And one last question, Dr. Mann. And first of all, thank you. It's important for us to know that you are the person in your job who has to worry about these things at the CDC, and you are being very clear with us that the combination of these three at this time, all coming together, as Dr. Frederick said, this is worrisome. And I think we just want to make sure that we are clear with our audience that these are important. Real fast question. Can you be vaccinated for the flu and for COVID at the same time?
Yes, it's a very clear, simple answer. You absolutely can. It is safe to be vaccinated with both vaccines at the same time. This has been studied scientifically, and it's actually considered best practice for medical providers to offer both vaccines at the same time. Of course, people have the option of choosing to get them together or choosing to get them separately, but there is no problem whatsoever with getting them together.
And by the way, do you also recommend that seniors get the pneumonia vaccine also at the same time, or should they wait and sequence those?
They can get the pneumonia vaccine at the same time as well. The pneumonia vaccine has the recommendations could be a little bit complicated, and so it's important to consult with your healthcare provider to find out what you're due for when. The flu vaccine is every year. The COVID vaccine, we're saying to get this updated vaccine now, but the pneumonia vaccine isn't given on an annual basis. So it's important to check with your provider so that you get the right advice, the right dose for your situation.
Well, thank you so much. And as I let you go, there's one tip I want to make sure that our audience gets, and that is, I know that all the physicians that are on this show today, and all the physicians that I know, when we need to know where to go to get the latest information about COVID, the latest recommendations, we go to the CDC website. And I'm sure that you would agree with me, Dr. Mann, that it is a great place for the public to go to get trustworthy, science-based, evidence-based information that is the state of the art. And would you concur that this is a great place for the public to go as well? And what is that website address?
Yes, I absolutely would. And the process that we go through in terms of reviewing the evidence, synthesizing the evidence, and then presenting the evidence, both for the general public as well as for providers like myself, is very rigorous and quality controlled. And I think it's fantastic information. I go there every day myself. And our website it's simple. It's cdc.gov.
Can't be any simpler than that. cdc.gov.
Yeah.
Dr. Mann, thank you so much for joining us. We really appreciate it.
Thanks again for having me, and sorry for my technical problems.
No, it was no problem at all. And now we're going to dive very deep into the vaccines. And I can't think of a better person to tell us about where we are with the new vaccines, what's going on with them. And that's our good friend, Dr. Peter Marks, who is the director of the Center for Biologics Evaluation and Research at the FDA. That's a mouthful, but I can make it simple for you. Dr. Marks is the single person who is ultimately responsible for making the decisions about whether or not a new vaccine or related compounds and drugs get into the system of the country. He's the guy who is accountable, and we're so glad to have him. He will engage in a conversation with our colleague, Dr. Melissa Clark, a population health expert, emergency medicine physician who wrote the book, Excuse Me, Doctor, and the podcast of the same name. She's the founder and the CEO of the BHE Group, and she's, along with me, a co-founder of the Black Coalition Against COVID. Take it away, Dr. Clark.
Well, thank you so much, Dr. Tuckson, and have to first compliment you on the excellent way that you've been moderating through technical difficulties and everything. And Dr. Marks, welcome. Thank you so much for being here. So let's jump right into it. At the beginning of the pandemic, there was lots of concern about the safety of the COVID vaccine. And a corollary to that, of course, was the misinformation that we saw, much of which I spend time on the podcast, Excuse Me, Doctor, debunking, and which Black Coalition Against COVID has addressed in so many ways. So we're 2 years in, more than 12 billion doses of COVID vaccine given. What have we learned?
So I think we've learned that the vaccines are safe, that they can certainly prevent the worst outcomes from COVID-19, hospitalization and death, that the latest boosters can provide people with an extra measure of protection. And I think overall, I think I'm the first to say that these vaccines are not perfect. Little in life is perfect, but they sure can save lives. And people who we're seeing hospitalized now, most of the people still who are ending up hospitalized with COVID are people who have not been vaccinated, or who have received only one or two vaccines. So people who are fully vaccinated really reduces the risk of hospitalization significantly. And it's especially important for older people because their chances of being hospitalized with COVID, if they're not fully vaccinated, go way up. So again, they potentially can suffer the worst outcomes here. We should be vaccinated across the whole age spectrum, but especially if you are over 50, and especially if you're over 65, you should be up to date on your vaccination, because having seen enough people sick with this, we just don't want our friends and loved ones to be sick with COVID, even if they don't end up in the hospital. This is just it's no fun.
Absolutely not. And of course, people with underlying chronic diseases as well. You mentioned the updated vaccination. We've had it for the last couple of months, the new bivalent vaccine. Why did it need to be updated, and what's different about it?
Yeah. So I think the simple terms, the problem we have with COVID is that it is like something running away from us that we're trying to catch up with all the time. It keeps changing over time, and unfortunately, we've had to try to keep up with it by updating the vaccine. These bivalent boosters, what that simply means is that in addition to the original component of the vaccine, the vaccine is half of the original component and half a vaccine that is against a variant, one of the things that COVID has evolved, the SARS coronavirus 2 has evolved into. It's against that version of one of the Omicron variants. And it happens to be one that until last week was the majority of the circulating variants in the country. Now it's very important because it happens to have the ability to have efficacy against the variants that are now starting to circulate as well. And so this two-component vaccine updates the immune system so that one has a better chance of fighting off what is currently circulating in the country. So it is, when we say new and improved, we mean essentially new and improved here, because it will increase the body's ability to fight off COVID-19. And we're hoping that when all the dust settles, that we will see that this has protected the population against hospitalization, death, medically attended visits, and for that matter, symptomatic disease from COVID.
Great. So now that we know what the bivalent or two strains vaccine is, who should be getting it? And tell us a little bit about how soon after you've had a booster already, or your series of two initial vaccines, or have had COVID, what's the time frame after which those things have happened that you should consider getting this new updated COVID vaccine?
Right. So from my perspective, anyone that is eligible, which for this at this point in time, it's anyone 5 years of age and up, should consider getting a booster. I can tell you that my entire family has been boosted, and that includes some 20 somethings in the family as well. But the people who, and I say this not to say that the 20-somethings shouldn't get boosted, but the people who really should make that extra effort right now to get out there are people over the age of 50, those who have other associated diseases. And we know that about a third of people over the age of 50 have things like diabetes, high blood pressure, things that can put them at risk of more severe outcomes from COVID. So yes, everyone should get it. But for those who are older, who might have those other diseases along with them, especially if they have respiratory diseases, asthma, chronic obstructive pulmonary disease, now's the time to go out and get this. The ideal time is at least 2 months after your primary, the last dose you've had. So waiting about 2 months after the last dose that you've had. And if you've had COVID, we've had a variety of advice about this. You could probably wait up to 3 months, but there's no minimum waiting period. And I think in general, we're very comfortable seeing people get the bivalent booster. At least, again, if they haven't had a vaccine for 2 months, and they had their COVID a month ago, perfectly fine to go out and get the vaccine. Again, it's updating the immune system against these variants and they are really circulating in ways that are making our head spin.
Sure.
In terms of how fast they're coming along.
Right. We know about all the multiple variants that are out there of Omicron. And so thanks for that summary. Anybody 5 years and older, especially those with underlying chronic disease, those who are older and waiting about 2 months after your last vaccine, up to 3 months maybe after your, if you've had COVID. So thank you. So now we have all heard, of course, about the mRNA vaccines for Pfizer and Moderna, but there's a new kid on the block, right? Novavax. Tell us what's different about the Novavax vaccine and who is it for?
So the Novavax vaccine is made by a more traditional vaccine making technology. It is a vaccine that's made, it's a protein based vaccine. The way the mRNA vaccines from Moderna and Pfizer work is they give you a piece of genetic material that lets your body make the protein. In this case, for the Novavax, the actual vaccine is the protein itself, along with a chemical that helps stimulate the immune system. So that combination is kind of it's a vaccine technology that's been around for a long time. Some people feel more comfortable with it. It was shown to be safe and effective in trials. And so it is a good option for people who have had concerns about the mRNA vaccines. Now, I would say to you, you shouldn't have concerns about the mRNA vaccines. They are safe. They are very effective. But for those who had some concern about that, and there were some people who had potentially had religious objections to some of the manufacture or what went into the study of those mRNA vaccines. This is one that that some people are willing to accept. So if you're willing to get vaccinated, if this is what it takes to get you vaccinated, go out and get this vaccine. The best vaccine is the one you'll take. So
Absolutely.
just go out and get it.
Well,
great. Well, I see Dr. Tuxen is back. Do we have time for one more question?
No, I tell you what we'll do.
To you?
Yeah, we're going to keep going, but I'm actually pleased that Dr. Marks and Dr. Clark will be available as we get more of the questions in the chat and come back later in the show. So thank you both. That was terrific. Really appreciate it. Well, now we talked earlier about Black women being the health office of the community. And so let's take all this information and make it real. Let's discuss how it relates to how we live our lives and the choices that we must make during this holiday season and beyond. And so joining us today, tonight now, are Reverend Kimberly Williams. I mentioned earlier that there was a health navigator from the Choose Healthy Life movement. And Reverend Williams is one of those people. We're also joined by Media Bardanilli, president of the Black Nurse Collaborative, Dr. Dee Banks, who is a good friend of this program, who is with the Northeast Ohio Infectious Disease Associates. And also we're joined by Dr. Yolandra Hancock, founder and CEO of Delta Health and Wellness Consulting, and another of the co-founders of the BCAC. Let me turn to you, Reverend Williams. You're out there in these churches, your colleagues are, being the health navigators deputized by the pastor to work with the congregation. What are you and your colleagues seeing in terms of some of the challenges that you're having to navigate?
Thank you, Dr. Tuckson, and thank you for all of the hard work and effort that you all put into our community and for bringing us together tonight. To answer that question, we are still seeing our community is still questioning, right, how this vaccine impacts them, specifically our women, because there's still some questions around how it impacts their fertility, how it impacts their children. Will there be some post concerns once the vaccine is there? And I think one of the most important parts of that, and what we're continuing to do with our work, is continue to try to educate the community around this and being able to provide the knowledge in a way that it's digestible. And so I think the other concerns we're seeing is how do they choose when we're talking about the importance of our health, but they're facing food disparities with the rising costs of the things that are taking place in their communities. Sometimes they're choosing to feed their family as opposed to proactively making sure their health concerns are cared for. So we're facing those challenges primarily with inflation. It is now, how do we make sure we cover our rent? And we're trying to make sure that we help them by bringing the resources to them. So it's helping them also to have paths to those resources. A lot of times we provide a lot of resources in our communities, but they're not taking advantage of them. And so it's how do we make sure that the resources are accessible? How do we ensure that they have access to health care? When it comes to insurance, how do we really equip them to be able to have what they need in order to address their health and wellness and make sure that they're getting their vaccines, staying current on their vaccines, and staying boosted?
Let me really emphasize something very key here that you've said. I think the premise of this show, which we've tried to be very transparent about, is Black community staying together to fight for our lives. No people but a people can save a people. Let's be frank. We have to take care and save our own selves. And so these kinds of challenges that so many women in our community are facing, and which you have articulated that you're discovering, let's remember that we have assets. Our social and fraternal organizations have assets. Our faith leaders and organizations have assets. Let's reach down into our brothers and our sisters and make sure that when we see people suffering, if there's a senior citizen who can't get vaccinated and we know they need to, let's drive them to where they've got to go. So Reverend Kimberly, I appreciate that. Let me ask Dr. Hancock right quick on this question that you mentioned that people are worried about fertility and those issues. Dr. Hancock, do we need to be in fact concerned about the vaccines and the concerns with fertility?
Absolutely not. What I have found in now almost 20 years of practice is that, particularly for anti-vaxxers, this is the recurrent fear, is that with every new vaccine, there's a link to infertility. For HPV, we saw this happening as well. Any new vaccine, there's going to be this scary message that comes out. We have now had billions of women across the globe receiving, particularly the mRNA vaccines, and there's been no scientific evidence to show any difference in the ability to conceive, any difference in the ability to maintain a pregnancy, and any difference in the ability to then deliver a healthy baby. If anything, what we have seen is that pregnancy outcomes have improved because of the COVID-19 vaccine. We know that pregnant persons have higher risk of complications from COVID-19 infections, particularly when they're not vaccinated. They have a 50% greater chance of being admitted to the ICU. They have significantly higher risk of dying from COVID, and they have higher risk of having preterm births and stillbirths. That's what we know about COVID-19 and pregnancy. What we also know about the COVID-19 vaccine in pregnancy is that it decreases the risk of severity of symptoms. It improves pregnancy outcomes. And not only that, I always say breast milk is medicine. The antibodies that a mother gets while she's pregnant, if she gets the vaccine while pregnant, and then once she's breastfeeding, those antibodies transfer over to the baby. And so there is no reason for a pregnant person or a breastfeeding mother to not get the COVID-19 vaccine. And if she's gotten it, to not get the booster. I actually had a conversation with a mother just today, encouraging her to get boosted.
Well, thank you. Midi, nurses are trusted. I mean, let's be frank. And people will ask you and bring issues to you that they may not bring to anyone else. What are the kind of questions that you find that you're getting these days from the women that you are encountering?
Thank you, Dr. Tuckson, for the opportunity to speak. And I must say, yes, I'm appreciative of all my physician colleagues and friends that are on, and nurses have continually remained to be the most trusted profession, particularly in the healthcare field, for over a decade now. So I'm proud to be a part of that. And to your question, I'm going to use your label, Dr. Tuckson, that nurses are also the chief health officers. Many times what we've seen in our community is that the messenger is more important sometimes than the message. And we've seen that during this time with COVID. A lot of the questions that we still continue to see and hear, not just myself personally, but I think nurses in general, is when do we get tested for COVID? Are the vaccines safe? We just spoke to Dr. Landra, spoke about regarding the infertility concerns and also the amount of reinfections that you can have with COVID. And also, as we spoke earlier in the program, when should I get my flu shot? And should I still do that in conjunction with my COVID vaccine? The other thing that I think is very concerning that I'm seeing, Dr. Tuckson, is the uptick of a lot of the other comorbidities that have been neglected over the past 2 to 3 years since we've been navigating this little thing called COVID. So African Americans already have had a disproportionate impact on our health from those chronic diseases such as hypertension, diabetes, obesity, kidney disease, etc. And so now what we're seeing, I even personally over the last few years have seen an uptick in personal friends that have had an increased number of diagnoses and cancer. And so I think it's also important to make sure that even as we're speaking about COVID, even as we're speaking about getting your vaccinations, it's important to make sure that we are still circling back to ensuring that we're getting our other health interventions taken care of very timely. I myself, making sure I have my colonoscopy done this year. I had to get 2 mammograms done this year. So I think as a nurse, as a Black woman, as a mother, as a wife, as a daughter-in-law, et cetera, as a daughter, it's important to make sure that as nurses and healthcare professionals, that other individuals see us doing the work and the message that we're spreading to others as well. So for me, I want to make sure that this message is also very inclusive of our health overall, because COVID, I think, is just another one of these comorbidities that we're going to continue to see that disproportionately impacts us as African Americans. And again, nurses are really the face of healthcare. And so shout out to my Black Nurse Collaborative, because that is what we're seeking to do, to make sure that we are highlighting these health inequities and disparities in our community.
Perfect. And let's make sure then that with that open invitation, that if there's any woman there out in the audience who has any questions that they need to ask and they're reluctant to bring them forward, go to a Black nurse. And Black nurses are everywhere. Thank goodness, we're easy to find. Please go and ask those questions. Don't be shy. There's too much at stake. It's our lives at stake. Dr. D. Banks, you talk to people all the time. You are just ubiquitous out there in the community, fighting for not only this disease, but other infectious diseases. What are the kinds of questions that you are getting the most from the people you interact with?
Good evening. Thank you so much for having me, Dr. Tuckson. I'm happy to be here. Some of the questions that are being asked of me have been addressed tonight, like pregnancy and fertility. I'm glad that Dr. Hancock brought that up and dealing with that. But I think I need one of the things that has not been mentioned tonight that some of my patients are starting to read about and be concerned about is long COVID. There's some data that's coming out now that women are more affected, disproportionately affected with long COVID, Hispanics, people of color, transgender individuals. And I think that the reason that that is important is that it's important to, when you're when you are a trusted messenger, to encourage individuals to get vaccinated. You sometimes hear people now, well, if I get a little mild COVID, it's okay. No, we're finding now that long COVID can be associated with patients that are symptomatic and that are not symptomatic. And so I think a lot of the issues that we saw with social determinants and healthcare disparities when we started to see COVID-19 in 2020 are being mirrored now when we're looking at long COVID-19, and the same kind of social determinants and healthcare disparities are still there.
So let's really double down on this one, because there are a lot of people that I hear in the community, Dr. Banks, that are sort of saying, well, I'll ride it out. I'm willing to take a risk. I'll see. And maybe it'll just be like the flu. But I think what you're saying is that when you sort of get into this long COVID business, that first of all, it's unpredictable, but the impact of it can be very dangerous to people. Am I correct?
You're absolutely right. And the issue is we don't know what we don't know right now, because there is a lot of underreporting of long COVID, because the symptoms like RSV, influenza, and Corona-19, they overlap. And a lot of the physicians, a lot of people are not going to come into the emergency room if they have brain fog or if they're fatigued or tired. And so a lot of physicians need to be educated about long COVID. So we got a lot of work to do.
All right. Well, thank you for that. And as we end this segment, I want to come back to Dr. Hancock for one moment. And that is a very quick answer here. People are going to be gathering together in their homes with grandma and grandpa and others. Dr. Hancock, in addition to being vaccinated, which, let's be clear, that is the number one job, what else do we need to do to make sure that we don't give the gift of COVID this year to our loved ones?
It goes back to basic public health 101. If you're sick, forego the Thanksgiving with the family. We certainly don't want to put our family members at risk. Certainly give consideration to the requirement of wearing masks. If you're in an area where you can actually eat outdoors, we recommend it. At least open a window, invest in an air purifier so that you decrease the risk. And even more importantly, everybody test up. Tests are very readily available. Everyone can know their status within 24 hours, even the day of Turkey Day. Go get tested to know what your status is before you spread COVID cooties around.
Wow. Thank you so much for that. I know that last year when in my holiday season, we made sure everybody had their test kit. We tested before we got on the plane. We tested the morning of the dinner with my 96-year-old mother. And so we really were and unfortunately, my daughter-in-law tested positive. And so the grandkids went to the dinner, but my daughter-in-law stayed in the hotel. And that was just what we had to do to protect her. Thank you all for being real. Black women, you're terrific. But as we turn to the next segment, we're not leaving our brothers out. And we're going to get real with our brothers. And I want to start the conversation with Black men with a very important short video. Ellis Dean, our producer, would you please run that video, please?
Scene 103, take one.
Taking my vaccine is staying safe. That's what you want me to believe. Of course. They're saying that the vaccine is 99% effective, right? Where are you going with this? What about the one dude?
I want you to get the vaccine because I care. I want you to be safe. If you was to die, man, that would literally kill me, man.
If it made you feel that way, bro, I would probably do.
Love you too.
Well, those are two of our good brothers. One is Wesley and Amir. And if we can put them on screen, it would be terrific, because we really want to understand from them. That was a very tough conversation to have. Black men, Akeem and Wesley, Black men don't normally show that kind of emotion that says, I love you so much, my brother, that I'll even cry if it means that you got to know how I would hate to lose you. And so which one of you wants to start? How in the world did you all get to that moment, and what did it feel like?
Oh man, it was real. It was crazy. Hey, you want to start it, Wes? Go ahead, bro.
No, it was just tough. I didn't expect that emotion from him. I didn't expect him to give me that. And when he gave me that, it was just hard. It was like, we both had different opinions, and we both felt like each other was right. But when when you get to the point where you break down, you show that emotion, like he didn't want to lose me type of emotion. It's like, it was almost hard to fight against them. It's almost like, what am I fighting for? Like, why am I so against this? And like, he wants it. Like, he's saying he wants my survival. Like, he wants me to live. I want to live too, but like, he was on a whole nother level, and I was just like, wow, like that's
because
wild.
the director asked me a question. He's like, "What's my greatest fear?" And I said, "Losing him, losing my brother. He's my greatest fear." Like, I can imagine a family member in a hospital, watching their loved one go through a series of, the respiratories on their face and stuff, trying to give them oxygen, and the doctors are saying, "Hey, we don't know what to do. We don't got any more options." And you can hear your family member say, "Oh, give me the vaccine now. Give it to me now. I want it." And the doctor's saying, "I can't do that because it was a preventative. You're too late." And so imagine me pacing back and forth in the hallway, trying to answer my mom's call, telling me, why didn't you help your brother like you were supposed to? You're the oldest. Why didn't you help him? And I said, I tried, but he said no. And I don't want to go through that. I don't know how to explain that.
Yeah.
So,
And it's crazy. We had conversations about it before. Like, we had arguments about me getting the vaccine before, but it was never on that depth. It was never on that level. It was more of like, I felt like he was trying to get me to do something I didn't want to do, more so than the love. And then when he said that time, I felt like the emotion. I felt the love. I felt like it's bigger than you and me. It's like our family wants you to have, not just me, like our mom, our grandma, like even our 91-year-old grandma got it. You can't get it. It's more of that.
Yeah, he got it.
It was more like that. Like, damn, okay. I gotta.
Hey, man. Well, let me tell y'all, brothers, y'all are a great example. I want you to know, the first time I saw that, I got a little tear in my eye. And then after I kind of dabbed it, because, we learn how to mask it, you know what I mean? So nobody really knew. But I picked up the phone and I called my brother. And I called my brother and said, "Hey, man, I just want you to know I love you." I mean, that's like, that's kind of hard sometimes.
Yeah, that's hard.
But I said, "Hey, man, I saw these two brothers, man," and I said, "Man, I just want you to know I love you." And what do we got to do to make sure we're gonna be okay on this one and everything else? So listen, there's a lot of people that'll channel y'all. So I want to thank y'all for joining us today, man.
Yeah, of course.
Really
Thanks for inviting us. I appreciate it.
All right, brothers. Y'all be good, man. Thanks
You
again.
too, doctor. Thank you so much.
All right. Do we have Warren Moon on yet? Is he connected? I'll wait and see if he is. If not, I'm happy that Dr. Stephen Thomas is here. Stephen Thomas is a hero of all of ours. Stephen has been fighting the fight in a most special and important place, and that's in our Black barbershops and beauty salons. Welcome, Dr. Thomas, and tell me, please, why is it so important that you have dedicated your life to working with beauticians and barbers in this fight?
Well, first of all, Dr. Tuckson, it's an honor to be here and to meet Akeem and Wesley. I am telling you, when I saw that spot, you know what it reminded me of? It reminded me of the sacred space that is our Black barbershops and beauty salons. Because I'm sitting in there at times, Dr. Tuckson, and I'm saying, when was the last time I heard Black men just belly laugh? I mean, just fall out on the floor kind of laugh. I realize that in our daily lives, sometimes we cannot express our full human emotion on the job. So yeah, in the shops, there's anger, there's back and forth, but it's all about a relationship. It's not transactional. And so one day, Reed, I'm sitting in the barbershop just like normal. We wear different hats, right? And the barber's not going to say he's going to get you out in 10 minutes. No matter how much hair you have, he's going to be there a while, right?
Yeah, he's going to be there. That's true.
I do believe, Stephen, that's the first time I've ever seen you without a hat on, man.
I don't know who I am without it. But
it's a great looking hat.
And you know how it is when you come in, it's like a contact sport. Everybody bumping, boom, 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 all that masculinity. And Joe comes in and Reed, people hadn't seen him. Joe, where you been? They hospitalized me. They said I had a heart attack. They kept me for 3 days. And everybody in the barbershop's listening. You brothers know how that's a community conversation. Pulled out a bottle of pills, Reed. We're all listening. He says, the doctor told me I'm going to have to take pills the rest of my life. And the barber said, Joe, if you take those pills, you won't be able to keep up your obligations. Now, do I have to explain that to you, brothers? I said, what if the barber worked with us as a partner? What if the barber would have said, hey, Joe, if you're experiencing side effects, dysfunction, don't be ashamed. Tell your doctor. And that began realization that cardiologist had no idea there's somebody in the community that kind of influence. And I began the process of building what we call HAIR Brothers, Health Advocates in Reach and Research. We had that in place when the pandemic hit. And we put the first needles and arms for vaccinations in a barbershop. And that's when I got that call. Dr. Webb, can you scale this? And I want you brothers to know that with the support of Reed Tuckson and Cameron Webb and the White House that launched Shots at the Shop, over 1,000 barbershops and beauty salons across the country joined in. They are now an army. And Reed, you know what they call themselves now? Wellness warriors.
I love it.
With Black Panther hats on.
Yeah.
That's exactly what we need. And I see that emotion, that love for one another, and it happens in the sacred space. And the young people, the young brothers coming up, the teens, and the young, they need to see that, Reed. They need to see a side of masculinity that allows us to deal with the trauma, the emotion of the loss that's happening in our communities.
Well, that's terrific. Thank you. And I'll come back to you in a minute, Steve, if I can. But one of the things that happens in the barbershop is a lot of conversation about sports. And so I'm really, really happy and excited to bring into this discussion one of my all-time favorite athletes, 9-time Pro Bowler, member of the Pro Football Hall of Fame, NFL alumni ambassador, Brother Warren Moon. Warren, thank you for joining us, man.
Hey, thanks for having me on the show. How you guys doing?
Oh, man, we're doing great. Listen, this is a holiday-themed town hall, and we know that people are going to be around the TVs on Thanksgiving watching the football game. So, I got to ask you one quick question about this new group of young, talented Black quarterbacks who've come into the league. Which one are you most enjoying watching?
I love watching Patrick Mahomes. He's a guy that has so much ability as far as his arm talent is concerned, and he's a great competitor. He can throw the ball from all types of different angles. He can throw it with his left hand. He throws it underhand. He does everything with the football, and he's a winner. So, the kid's only been in the league 5 years now. He's already won a Super Bowl. He's been to 2 Super Bowls. He's been an MVP of the league. So he's off to a tremendous start in his young career. So I love watching him. I love watching Lamar Jackson because he brings a whole different twist to the game. He's not the traditional, drop back passer, but one of the most exciting, energetic players that you ever want to see. Just a very tough guy to prepare for because he can throw the ball as well as run the football as well as any running back. So those are 2 guys that I really enjoy watching, but there's so many good young African-American quarterbacks in the league right now. I'm just happy, and I stick my chest out a little bit every time I see these guys playing, every time I see how much money they're being paid, every time I see them on a commercial. I just feel proud of the fact that I played a little part in making that happen because of the way I was able to play back in my day.
Well, beautiful. Stephen Thomas, now you got a lot of ammunition in the barbershop, so you'll be able to really impress everybody. Warren, so many retired NFL players and other professional athletes have come forward to talk about the importance of getting vaccinated against COVID. Why have you decided to take this on? I mean, I really admire you for your dedication to this fight.
Well, I think it's a very important subject. First of all, we've only been through one pandemic in the last century, right? And if anybody thought that this thing was fake, they must be crazy because all these people that have passed away and that have been definitely sick over this disease, it's something that's for real. And I've been vaccinated all my life. I got polio vaccinations. I got vaccinations for chicken pox, all types of different things when I was going to school as a young kid. And a lot of those vaccinations kept me from getting deathly sick. So I had as much trust this time as I did back when my mother used to send me to school and we got vaccinated at school that our health professionals were going to give us the best best medicine to put in our bodies to fight this thing off. I know there was a lot of conspiracy theories out there. There was a lot of mistrust by the Black community because of what people were saying about what some of these vaccinations could do to you. But I just had complete trust that they were doing the right thing. And because I had them so much in the past, I just feel like it was something that you needed to try. Because if you look at all the people that died from this, millions of people died from this disease or this virus. It was worth taking the chance to do it. So I urge everybody else to take the vaccination if they can get it, as long as they know it's not going to hurt their life in any way going forward. But that's just kind of the chance that you're going to have to take, because if you don't do anything about it, you could end up passing away or being deathly sick. So I'm behind it. I'm hoping that our government is doing the right thing as far as making these vaccines, making them safe for everybody. Does that mean everybody's body is going to take to it that like everyone else? I'm not sure, but I know that I've taken 4 so far and I've been fine. I never even got sick one day from any of the vaccinations that I took. So I'm definitely going to pass my experience on to other people, that this is something that you need to get done in order to protect yourself, so you don't end up passing away before your time.
Well, thank you so much, and thanks to all of you brothers. I would say, so the notion is, when you're watching the football game on Thanksgiving, think about what Warren Moon is saying, and if there's somebody that's passing out misinformation or a bunch of nonsense, say, hey, it's good enough for Warren. Look, pay attention. And then if you get into the family argument, just remind people and show and just rehearse the video between Wesley and Akeem, and grab your brother. And if you got to cry over your brother, cry over your brother. Whatever it takes, not only protect your brother, but to protect mama, grandma, grandpa, and so forth.
Right.
And then when you're in the barber, Stephen Thomas, talk to your barber. There's a lot of craziness that goes on sometimes in there because of Stephen Thomas. We've got the facts being delivered all through there. Thank you, brothers, so much. I want Dr. Lanza, you to stay and bring back our medical panel, if you would, please, as we start to close out. Thank you all so much for talking about making it real for our brothers. We appreciate it, Warren, Wesley.
Thank you, doctors. Appreciate it.
Yeah, thanks, Dr. Reed. I just wanted to, not let my, show my brother that, not to be afraid to say I love you to him. A lot of people don't open up emotionally like that, but I can sit there and say to them, I love him.
Man, y'all are beautiful, brother. You make me proud. Thank you. Thank you.
Thank you.
All right. Well, as we start to end up here, I want to just kind of use, we've dealt with most of the questions in the chat, but I still want to kind of come back to some of the ones. And Dr. Lanza, you are a pharmacologist, and I want to just double down on the issue around Black male. We asked about the women and Black male fertility and potency. Is there a reason as a pharmacologist? Now you're changing hats. This is not your organization hat. This is your professional hat.
All right.
Speak it real. Do we have to worry about that or not?
Bottom line is no. There are data that corroborate and or support that there is no impact that has been reported to date in changing the virility or the sperm count and motility of the sperm for a person that's taking COVID-19 vaccinations. I think it's very safe. I know it was spoken of earlier by the previous panel. And even there are data that support that if people are trying to conceive, that it is appropriate for them to receive the COVID-19 vaccination. I tell the Black community, as a leader in the Black community, to follow the science and data. Conspiracy theories, I'm so glad that Warren Moon was before this panel coming up, which we're participating in now, because he spoke correctly, as the other brothers had done, that just talks about all of the fears that drive us. But the data, the scientific data that we can go and we can see from a randomized, double-blind, placebo-controlled trial, which is the gold standard, but clinical trial data matter. And also safety monitoring data matter. And those of us who are in industry and a part of the continuum pipeline, the non-ending pipeline that brings new medicines to the market for people to take, and we want to make sure they're safe, and we work in conjunction with the FDA and CDC to ensure that those things take place. And we need to make sure that the community is informed. It's part of the reason why I shared earlier that we have training for those who are members of my organization to prepare them to talk to the community in an educated way. And that they're using data and dispelling those fears. And mind you, there is historical data around, for example, Henrietta Lacks. We talk about the Tuskegee experiment. Sure, those things did happen. But now we also have the ability to request even from our healthcare providers. Can you show me the data? Show me the study that's supporting that. And there are studies now that support that there's no loss in motility or sperm count around the vaccination with the two mRNA viruses in particular. I know I've seen even the data for those, and we will continue to build the data to support that.
And I'm happy to know that also the data on the Novavax is also very comfortable and secure as well. We're going to let me alert the production team that we'll go a couple of minutes long, not many, but I want to get a round robin from each of our guests here one more time. And I want to start with Dr. Marks. One of the things that you said, Dr. Lanza, and you were correct to reference back, that we had the Henrietta Lacks experience, the Tuskegee experience, and so forth. Dr. Marks, I commend you for taking special effort to ensure that Black scientists and physicians are part of the approval process. Could you just give us a sense of that and assure the audience that this issue is being well taken care of?
Yeah, so we pride ourselves on the fact that we have a very diverse group that worked on the review and the approval of these. Those who watched our advisory committee might have noticed that there might have been a president or two of historically Black medical colleges that were part of those advisory committees, and those were, besides those individuals, there was additional diversity. That's critical because we really need to make sure that people feel the trust here and that they feel like they were represented in how these vaccines were reviewed and ultimately authorized or approved.
And I think it's also important that our audience understand that Peter Marks, again, has been with us for just about every show that we have done. And there's been a lot of them over the last couple of years. And what I'm indicating here is, unlike the Tuskegee experience or the other insults in the past, where we were not in decision-making or positions of influence, we are with this one. We're at the table watching it carefully. So, Dr. Marks, I really want to thank you. Dr. Clark, if you think of one question that we have not addressed that comes up the most, or something that you want to re-emphasize as being extremely important as we start to close out, I want to make sure that we don't leave anything on the table that we should have addressed.
Thanks, Dr. Tuckson, for that opportunity. I would say that there's a lot of confusion around this idea of, if I take my vitamins, if I take my elderberry, if I take my my seaweed and sea moss, that's going to be enough to protect me against COVID. It's important to understand that if you have not been vaccinated, those things are wonderful, for health purposes in general, but they don't create antibodies. Antibodies fight disease. There are only two ways to create antibodies. One is to get sick with the disease, or two, to get vaccinated. The much safer route to take is to get vaccinated. And then where taking your vitamins and eating healthy and getting enough rest comes in is it allows your body to be primed at its best and highest ability to make those antibodies in response to the vaccine. So I just wanted to bring that out because there's so much confusion around that. It's great to be healthy, really focus on that, but it goes hand in hand with vaccination and with getting boosted.
It's a belt and suspenders, as always.
You got it.
Let me turn to you, Dr. Banks. What is the one question that you get the most that we have not addressed, or the one that you want to double down on and make sure that we all get it completely correct?
Well, I want to double down on the CDC recently said that it's okay for you to not wear masks in a lot of our healthcare facilities. And I'm working in the trenches every day. in the trenches. And I tell my colleagues and my nurses and everybody else, just because someone tells you that it's okay to take your mask off, that might not be in your best interest, that a lot of these viruses are circulating. And you need, and especially during the holidays, Dr. Tuckson, which is why I'm glad you have the show. I want to double down on get vaccinated. Get vaccinated.
Beautiful. Thank you so much. And I know I've been traveling in airports a lot the last few days and weeks. And one thing that amazes me is that this is not a scientific study, but it's so obvious, more Black folks are wearing their masks than white folks. And one of the things that's really sad, and I have to feel bad for our white brothers and sisters, is that they got the bad messaging, particularly in Trump country. Let's be clear. Those places, they got bad messages, and unfortunately, they're dying. They're dying at much higher rates than the Black community is now. And so this is unprecedented in our history. And they swallowed all the misinformation, and as a result, they're dying. So wear your masks. And we're still doing that, especially in airports and places where people are congregating. I still wear mine. And by the way, I got some really cool looking ones. They look very sharp. You color coded it with your suit. It's okay. You can still style, even if you don't have your hat on like Dr. Thomas. Dr. Hancock, one question that we haven't asked, or the one that you want to double down on as we close out the show.
So, of course, I'm going to talk about children. The one question that I get asked the most related to COVID is, why should I, as a parent, consider getting my child vaccinated when children aren't really affected by COVID-19? I give them 3 reasons. One, you don't compare children to adults, you compare children to children. In the span between 2017 and 2020, close to 500 children died due to influenza. Between 2020 and 2022, 1,544 children have died due to COVID, the majority of those children being Black and brown. So that's the first reason. I look at just and not to use scare tactics, but to use real numbers in terms of comparison and how disproportionate COVID has impacted children. Then we talk about, as Dr. Banks talked about, long COVID. There are 2 studies that just came out this week showing that the risk of long COVID among children and adolescents, the relative risk is the same as for adults, but it's even more difficult for our pediatric patients because it's hard to diagnose. Children are showing up with brain fog, mood swings, difficulty concentrating. That could be misdiagnosed as ADHD, a bunch of other things. And then thirdly, the collateral damage from little ones being exposed to and or infected with COVID in terms of missed days of school. Our children have been so significantly impacted academically and socially because of school closures and having to stay out for at least 5 days. Those are the reasons that little ones need to be vaccinated. When we hear about all of these mistruths and distruths, it's providing that information, letting them know that it isn't just, if I get my child vaccinated, are they at risk for fill in the blank mistruth? It's looking at that same risk when it comes to the COVID-19 infection. What is the risk of heart inflammation and heart complications with the COVID-19 infection versus whatever small relative risk there may be with the COVID-19 vaccine? And when you look at those numbers and provide that data, it is a no-brainer. The vaccine, by leaps and bounds, provides protection. And right now, less than 5% of children in the school age range have received the COVID-19 bivalent booster. We have to do something. We have to get our kids vaccinated so that they can also enjoy the holiday celebration fully protected.
Well, thank you. And thanks to all of our medical panel. Let's just, as we close it out now, summarize. The title of this program today is COVID and the Holidays, Protecting Black Life Matters, especially this year. We had a really terrific beginning with the head of the COVID program for the United States, Dr. Ashish Jha, who really made it clear why he is concerned. We really got deeply into the perspective of the Black leadership, and we heard messages or either by messages or in person from leaders across the Black community, whether it's the faith community with Reverend Al Sharpton, whether it is through our fraternal and sorority organizations with President Catchings Hess of the Black Women's Agenda Incorporated, and also with, of course, Dr. Lonzo, Willis Lonzer from Alpha Phi Alpha and Vice Chair of the Council of Presidents. We've got a very clear understanding of the epidemiology or the threat of the triple threat of the flu, of RSV and COVID from the person at the CDC who is responsible for the immunization and respiratory diseases program. And then we had it got real with Dr. Marks, who really gave us what we need to know about the safety and efficacy of the Pfizer vaccine, the Moderna vaccine, and the Novavax vaccines, all of which were very important and really reemphasized the safety and effectiveness of all of those. And then, of course, we had the panel from Black women and are clear that Black women, as the health officers of the community, are engaged and will be even more engaged. And then we got real with Black men and really have a real chance to see what it is like to try to break down some of those stoic barriers where we get too tough to be able to be vulnerable around having the conversations to save our lives and to save the lives of our family. We end with the slogan that we've often used: no people but a people can save a people. We are motivated to save Black life every day, but certainly during this holiday. We want to thank our sponsors again, who gave us generous educational grants: Pfizer, Moderna, Novavax, the Black Coalition Against COVID, the National Medical Association, Choose Healthy Life. All of them participated in making this program possible. And I also want to send a special thanks to the people who work behind the scenes tirelessly, and that's Kim Jeffries Leonard and Mary Clark. We owe them a great deal of gratitude. Have a healthy, safe holiday. Thanks, everybody, for joining us. Let's all do what we need to do. Let's don't give the gift of COVID this year. Take care. Bye-bye.
Bye-bye.